My name is Jill Stevenson, and I manage the enzyme replacement therapy service for healthcare at home. I'm a nurse by background, and I've been with the company for 13 years. Some people would actually say you get less for murder, but it's been quite a sort of rapid progression of time. I'm accompanied by my colleague Sarah Carruthers, who's a service development leader for enzyme replacement therapy, and also Shelley Coulson, who's in the audience, who's one of our paediatric nurses. Just a little bit about the company. The company was established in 1992. We have 24 operating locations throughout the UK and Ireland, and we have a head office in Burton-upon-Trent. We have over 750 employees, and that's rapidly grown over the years, as you can imagine, and of which we've got over 400 nurses fully employed by the company. These are highly skilled and experienced nurses, as you would imagine, as would be the requirement for giving such complex treatments as enzyme replacement therapy at home. We employ both adult and paediatric nurses, and we also have our own fleet of temperature-controlled vans and drivers, which is what we use to actually get the enzyme to the patients at home. We have in excess of 10 years' experience of giving IV enzyme replacement therapy at home. Some of you may recall that Sarah Days, when it first came out, was the first ERT that was available for Gaucher's patients, and since then we've seen sort of rapid progression and rapid development and fantastic sort of achievements in terms of ERT available for the different disorders. We currently give all of the 7 licensed medications at home, in the home environment, and these are for Fabry's disease, Gaucher's, MPS 126, and also the most recent one is Pompe disease. As a company, we've got around 400 patients on enzyme replacement therapy at home. Now, they're not all the same. Every patient is different. The type of service, the intensity of the service that they require is very, very different, and which is why, you know, sort of ourselves, and I'm sure Careology work the same, we very much sort of do work with yourselves, the patients, the family groups, and also the centres to try and develop as individual services as we possibly can within the constraints that we do have. A proportion of our patients are nurse infused, which would mean that the nurse would go to the home and do the infusion every time it was due. And as you can imagine, as in the centres, then you do need strict protocols and guidelines for administering such therapies. Some of our patients, in particular the Fabry's and the Gaucher patients, they do actually self-infuse, or they have a carer or a relative who will actually do the infusion for them. That involves doing the cannulation, making up the enzyme, and giving the treatment itself. And as you can imagine, there is quite a significant amount of training that needs to go into developing and ensuring that the patients, the family, are actually competent in giving the treatment. And in giving the treatment, we don't just mean giving the infusion, looking for the right place to actually cannulate, overcoming problems with cannulation, making up the infusion, administering it, making sure that they dispose of the waste in an appropriate manner. So a whole lot of elements actually come into training for self-infusion. Like anything, safety is paramount. We really need to be serious about what we do in the home environment. We talk about infusions at home, but they're not all given at home. What we do have the option of is giving infusions in alternative environments. And for some of the young children who are now on enzyme replacement therapy, then it's important that they miss as little schooling as possible. So what we try and do, if it's possible, is to perhaps give the infusions within the school environment. Now, that's not suitable for every single person. We've got to take into consideration a lot of elements, including infusion reaction management. The infusion venue itself, is it actually suitable for treatment? Are people within the school environment, if we're talking about school infusions, are the school actually happy for the nurse to go in and do the treatments in the school? The service is supported by a 24-hour nurse on call. It's important that, you know, sort of the patients out there don't feel that once the nurse has been and done the infusion, that they're actually left there out on their own. We do have a 24-hour, 365 days of the year support programme out there. And I think the key thing to actually remember in all of this is that it's actually about teamwork. It's not about us going out there and treating the patients at home individually. It's about us working with yourselves, the patients, the families, the hospital teams, and very much we see ourselves as extensions of the hospital team. And that's quite key, so that the patients, the families actually feel comfortable, actually feel confident in then making that transfer onto home treatment. Now, hopefully that's just given you a sort of very, very brief overview of healthcare at home and about home infusions. There is a lot more that, we're more than happy to, sort of answer any questions, to tell you about, but Careology will be telling you a little bit more about the different elements of services, and we're all here to answer any questions that you may have.